Hello, this is Arlene Morris, and I want to talk with you today about changing roles and regulations in long-term care. This is for ASNA's Faces, April 19th, 2022, and my email address is here on the bottom of this first slide. The objectives for this presentation are that at the completion of this presentation, participants will be able to discuss issues that led to staff shortages in Alabama assisted living facilities and long-term care facilities during and post-COVID-19, describe ripple effects on the greater healthcare delivery system, and relate strategies to develop new roles and assistance for educating nurses to meet the needs of residents. High staff turnover in long-term care and assisted living facilities occurred in Alabama, especially since the COVID epidemic, due to the stress of the caregivers for providing care for those who were experiencing higher acuity COVID illnesses. It taxed the system to the max. The staff had higher emotional distress because of increased demands for supporting those who depended on family visits. You recall that at the beginning, the family visits were prevented due to risk of spreading COVID. Some of the pictures you saw on the news had the family members standing outside the window with signs and trying to support their loved ones. Well, that took a toll on the residents, but it also took a toll on the healthcare providers who were trying to provide emotional support to them and just drained themselves emotionally. And a mandated monitoring of spreadsheets for all who entered the assisted living or long-term care. They had to include their name, their vaccination dates, and this was the vendors, the milk carriers, the laundry, the ambulance drivers, fire trucks, anybody that came in had to be documented. The high staff turnover in long-term care and assisted living facilities was also due to the emotional distress and grieving of staff from the severity of the illness that was being experienced by their patients that they had come to love. The residents that were there, they had known sometimes for years, and they also were experiencing grieving as the families were. Another issue was the COVID-19 vaccine mandates. A high percentage of staff in long-term and assisted living facilities are female staff of childbearing age. Some of these individuals did not want to be vaccinated until more data regarding safety for any unborn children was available. And so when that mandate came, they were obligated to choose to move to another place of employment. And also there was a lack of personal protective equipment. In Alabama, there was actually documented cases of underwear, Hanes nylon underwear, being delivered to be repurposed as face masks, and trash bags for garment bags. And that's from the Nursing Home Administration Executive Director. That led to demoralizing effect on the staff because they perceived a lack of valuing them as employees who were working hard and were worthy of being protected. The high staff turnover was also due to staffing levels that are regulated by the Centers for Medicare and Medicaid for reimbursement. And so it's expensive to pay the salaries, and especially if there were agency staff that were being employed at a higher rate. Now, in Alabama, there are no state regulations for minimum staff. Centers for Medicare and Medicaid do have some, but in Alabama, there are no regulations. The resident to staff ratios can be met as long as the needs of the patients are being met satisfactorily. Another factor impacting staff turnover was that the pay was not very much higher than other service positions. So many staff left long-term care and assisted living to have employment settings in hospitals, clinic offices, school nurses, other roles that they could have that was perhaps not quite as emotionally draining. The vacancies that occurred when these staff shifted to other areas of employment necessitated hiring of agency staff. Well, agency staff cost the institution a higher salary, a higher rate of pay, because the agency has to get its cut. Currently, the Federal Trade Commission is working to prevent price gouging by agencies who provide healthcare delivery system staff. And the facility is responsible for background checks and proof of vaccination for all employees. That was not the agency's responsibility, that was the facility's responsibility. So therefore, all of those reasons caused an exodus out of some of the healthcare facilities by long-term staff that had worked together as teams, and they had known the residents, and so that led to agency staff working for their 3-month period, or whatever their contracted period was, 12 weeks or 15 weeks. And then if they chose, they could move to a hospital, to another long-term care or assisted living, to an office setting. And so there was constant turnover of the staff. They didn't develop the longer-term relationships that is often possible in long-term care and assisted living. The facility budgets were maxed out because of the higher salaries for agency staff, and so some of the wings needed to be closed. One of the examples in Montgomery was out of a 180-bed facility, 60 beds were out of service because they didn't have enough staff to staff that wing. And then the lack of the available rooms had a ripple effect that it slowed the transfers from acute care settings. So let's say someone had a fall and fractured a hip, and they were hospitalized, and they had the surgery, and they had their post-op days in the hospital, and they were ready to be transferred, but there were no beds because the wings were closed because there was no staff. So there had to be alternate options. Some were transferred home with home health and family caregivers, which had another ripple effect that the family caregivers often had to take a leave of absence if they were employed. Alabama Department of Public Health did contract with agency staffing from out of state to come help during some of the extreme shortages, and that was a Band-Aid approach, but that helped get us through those crises. And so due to those shortages in staffing, there have been some efforts at attempting to begin some solutions. So here are some different roles that you may see in your employment, or you may find if you go visit a loved one in a long-term care setting. A student nurse apprentice role. The student nurse is responsible for tasks that he or she has already validated in a course of study. Now, they must always be supervised by licensed staff on that unit or on that floor to assure that the outcomes are appropriate, because they obviously don't have the credentialing to do a full assessment and a post-outcome evaluation. But if they have learned how to empty a catheter bag in their school, then they can empty a catheter bag with supervision, which extends the nurse. It's a nurse extender type role, but it also provides a higher salary for these students. Instead of working as a beginning certified nursing assistant, they can work as a student nurse apprentice, and then they can go on to get their certification. There's also a different level. This is a medication assistant certified, or a MAC. in the Alabama Board of Nursing Regulations. That's in Chapter 14. Now, in this role, the Alabama Community College System is used to provide education. 100 hours is required, 60 in class and 40 in clinical. And in this role, a woman or a man is able to administer medications from a specified list. These are routine medications, and they're not a medication such as insulin that would require pre-assessment and post-assessment, or cardiac medications in which heart sounds needed to be interpreted. As of April 14th, 2022, 314 MACs have been approved by the Alabama Board of Nursing. Continuing with changes in the nursing staff roles. Temporarily, nursing assistants in long-term care could complete an 8-hour course. Now that has expired. That was really kind of an emergency option for people that had no prior training to come in and learn some basic safety skills to just provide physical assistance with the volume of care when the other staff was so very short. They were still not doing assessments. They were not doing medications. They were doing, simple skills, bed baths, simple skills. But that is now expired. That emergency no longer exists. Certified Nursing Assistants, CNAs, is a role that we're familiar with. They are certified through a 75-hour program in the classroom. They include written exams and clinical exams, performance exams of the skills before they're hired. Now, one thing that is really interesting is the Alabama legislature has appropriated funds to restart some LPN programs in 2022 and 2023, likely in community colleges. This is according to information from the Board of Nursing. And there may be some ways that a certified nursing assistant could test out, or a medication assistant certified could test out of some of the skills, but then the theory is that they can move from a certified nursing assistant, get some more education. The 12-month program of an LPN program would enable them to then sit for licensure as an LPN, and then potentially there are plans for an LPN to ADN programs with completion of potentially 2, maybe 3 semesters of additional coursework, and then that individual would be able to sit for their NCLEX for their nursing license. And then we already have several programs in the state of Alabama for ADN to BSN programs, and then we have ADN to MSN programs, and then of course we have BSN to MSN and BSN to DNP programs. So we see how at each stage of a person's education they can be employed and earn a higher salary than the basic certified nursing assistant. There's potential for growth through their development and their education, which is good for the employee because they make more salary at each subsequent level, and it's really good for the facility because these people are familiar with the residents, the other staff. There develops teamwork and collegiality. So this is potentially a very good strategy to help meet some of our shortages as each of us develop further our competencies to the next level. There is hope, as I've mentioned. We're grateful that in Alabama, no long-term care facilities have closed due to federal or state funding shortages. Most employees in long-term care work there in order to make a difference in the lives of others. The directors of nursing have reported that to the Nursing Home Association, that really they're there for the good of the resident. They love people. They want to do what's best to help them have a higher quality of life. Both themselves have a higher quality of life, but also the resident. Centers for Medicare and Medicaid, CMS, has proposed new regulations which are out for public comment. The reference citation page has these regulations for long-term care. I've discussed that with the Alabama Nursing Home Association, the Alabama Nurses Association, and some other groups, and they really encourage, please look at these new proposed regulations, read them. If you have a vested interest in this, if you have a family member that may be going to a long-term care facility soon, read these proposals and make a comment during this comment period. And I'll point that out on the reference page. As I mentioned, this is the reference for the proposed rules for 2023, the update on payment rates, diagnosis codes, skilled nursing, and quality reporting program. The file code number is CMS 1765P. Now you can find this at the federalregister.gov with this number, and then also at www.govinfo.gov. You'll need to put this file code number in. This is the comment period. Please look at this information, read it. If you have a vested interest, please make a suggestion or rebuttal to some of the proposed changes if you feel that they will not be helpful in our state. But take this opportunity while this is the open period for comment. I also had personal communication with Honor Ingalls at the Alabama Board of Nursing on April 13th. He was very helpful in discussing the transition across different roles and the number of people in the new roles that have been created during the COVID epidemic in our state. Katrina Magden at the Alabama Nursing Home Association was very helpful in discussing with me many of the issues that have been experienced by the staff at Alabama nursing homes and long-term care facilities. And Elaine Pogue at the Central Alabama Aging Consortium discussed the role of ombudsman in long-term care and in assisted living to assure quality by going and making site visits and interviewing the residents. And also, the second program that she discussed was the Ombudsman program that assists residents who are ready to be discharged to go back into the community with some assistance from Alabama at Home. And if you have someone that that this program may benefit, please contact your local ombudsman in your county or your district, and they can give you more information. I hope this has been helpful, and I appreciate all that you do in your role in healthcare for our state. These are difficult times, but it's good to know that there is hope and that we have an impact in helping the decisions that are going to be made. Let me know if I can be of any help to you. Thank you.